Our next presentation is Family Spirit Nurture, an Indigenous Solution for Promoting Healthy Infant and Family Nutrition.
Hi everyone, my name is Amanda, and this is my colleague Sarah Vanegas. And we're from the Johns Hopkins Center for Indigenous Health. The center was first founded in 1991 in the Johns Hopkins School of Public Health. The center's mission is to partner with Native communities to uplift health, education, and leadership. Through programming, our team focuses on strengths-based, culture-based, and evidence-based programming and implementation, while advocating and promoting tribal sovereignty and demonstrating impact. Before I get into Family Spirit Nurture, we want to first acknowledge the Family Spirit Program. A little bit about the Family Spirit Program. It is an evidence-based home visiting program taught by Native home visitors to caregivers from pregnancy to 36 months postpartum. The program began in the 90s with tribal communities in the Southwest to support teen moms. Family Spirit was designed to be delivered by paraprofessionals, home visitors from the local community. Key components of the model include home-based outreach, family involvement, and connections to community resources and services. Now moving more into the Family Spirit Nurture program. It was first initiated in 2016 in response to community requests to address early childhood obesity risks. Family Spirit Nurture is a 6-lesson home visiting module promoting healthy infant feeding and growth between 3 to 6 months postpartum. Family Spirit Nurture home visitors provide education, support, and connections to local and national food resources. Family Spirit Nurture is the first home visiting intervention created for and with Native families that has evidence of improving healthy infant growth. Curriculum topics include encouraging breastfeeding, infant responsive feeding practices, moderating sugar intake, healthy eating for the whole family, solid food introduction at 6 months, connecting to Native foodways and Indigenous foods, connecting to local and federal resources. Research from the Family Spirit Nurture lessons are associated with reduced sugar sweetened beverages, consumption among moms and infants, improved responsive feeding practices, longer duration of breastfeeding, and improved infant growth at 12 months postpartum. The next few slides show results from the 12-month intervention. There was a greater percentage of moms in the intervention group continuing to breastfeed at 6 months and 9 months. Moms in the intervention group reported statistically significant lower infant sugar sweetened beverage consumption at 9 months and 12 months. And infant ZBMI scores were lower in the intervention group at 6 months and 12 months postpartum.
So after we saw these really positive, steady results, we realized that the Family Spirit and Nurture intervention was really positively impacting families, and it was primed for expansion and scaling to benefit many more families nationally. So I'm going to talk a little bit about the work we've done over the past 2.5 years to disseminate nationally, and we're grateful to the Share Our Strength No Kid Hungry campaign, their generous funding that really made a lot of this work possible. We began disseminating the home visiting intervention within the existing Family Spirit network that was already well established across the nation. So since May of 2021, a total of 108 health educators have been trained in delivering Family Spirit Nurture. Now we've expanded dissemination beyond the Family Spirit network. Nationally, it's available to any interested home visiting program through an online training course, the online training platform Coursera. One of the new supporting tools that we developed is a free text messaging service. This is designed for any Native mother or caregiver with an infant 0 to 18 months old. The primary purpose is to push out key messages from the curriculum right to caregivers' phones. The messages are tailored to baby's age and include nutrition and feeding content, as well as supportive messages focused on mental health, parenting encouragement, parent bonding, breastfeeding support. The messages are tailored for Indigenous families and reflective of Native cultural teachings. We have these postcards to hand out in case you're interested, come see us. We also developed a website, Family Spirit Nurture website. It's primarily a landing site to learn about the program and sign up for the messages, but it also includes a library of native nutrition resources for both home visitors and families. So kind of in summary, some features of the program, it's a brief 6-lesson intervention that is impactful, yet doesn't require a large time commitment for families or programs. And it hits that critical window of time and opportunity between 3 to 6 months before infants are starting solid foods. This is the Shiprock, New Mexico Family Spirit Nurture Research Team, so a big shout out to them. This is where the original study took place. And it's amazing to witness how their passion and dedication to this work continues to expand and spread now throughout the nation. Thank you.